Hello, everyone. My name is Dr. Sandra Luyindula. I am the founder and CEO of The Well MD, a direct primary care practice located here in South Carolina. And it's where we really aim to have personalized care for and access for all people. And our biggest pet peeve here is really not knowing how much things cost. So we really pride ourselves in price transparency. But tonight, enough about me. It's all about our parents, our children that we want to talk about, those who have been given the diagnosis of autism. But I want to introduce our doctor tonight, Dr. Hokehe Eko. You will do a better introduction than I will ever do. So I will let you take the floor.
Thank you so much for having me here, Dr. Sandra. Such a pleasure to be here and to talk with all of you lovely people who are here listening. So my name is Hokehe Eko. As she said, I'm an integrative pediatrician. So what does that word mean? It simply means when I'm practicing, I combine holistic medicine, which is evidence-based holistic medicine, and conventional medicine together. So essentially, I look at the child as a whole, right? And I'm not just looking at symptoms, I'm looking at what's causing the symptoms of the child so that I can address those things, so that in the events that we have to do medication, at least we are doing medication alongside treating the reasons for the symptoms that our children are facing. And so I run Glow Pediatrics. It's a telemedicine practice where we do autism diagnosis, the evaluation process for children in about 12 states. And I also care for children who have the diagnosis of autism and ADHD from a holistic integrative standpoint. And I do that virtually. I have patients globally. So it's not just limited to children in the US. So what else do I do? I'm a mommy of 3 who keep me on my toes. And I also run a nonprofit called Kids of Hope. It's for foster children, just to encourage them and show them that they're valuable and they have hope. So that's in a nutshell is me.
Well, that's okay. That's more than a nutshell, but thank you. So tonight we are talking about Nourish to Flourish, food, sleep, and gut health in autism. So for all the parents out there, I just want to start with, what is autism? When someone hears autism, what is it?
Great question. So autism is a neurological disorder. And basically, to put it simply, it just means the child's brain works differently. It's a different brain type. And because it's brain-based, that means that it's important. It's not just one thing. Actually, let me rephrase that. So that we don't know what causes autism, right? It's caused by multiple things. There's a lot of environmental factors, as well as most of it is caused by genetics, right? So if you see a child with autism, most likely one of their parents has autism as well, or somebody in their family had it and it passed down. So a lot of it has to do with genetics, but also environmental. And we're still doing so much research. And of course, there's also a component with nutrition as well. So it's multifactorial, but it's a brain-based disorder.
So when it comes to diagnosis, right? So parents sometimes, we see our children, especially if it's not your first child, you will notice, hey, this is a bit different. Behaviors are a bit different than the other siblings.
Right.
When do we diagnose autism? And the sub question to that is, how can a parent advocate earlier on to get the help that they need?
Okay, so autism can be diagnosed starting at 18 months and all the way up. And we often advocate for early intervention, because what does that mean? The reason you hear pediatricians or doctors talking about early intervention is because the brain grows the fastest in the first 5 years of life. So if you're going to make any changes, and remember, it's brain-based, right? If you're going to make changes in how your child's brain functions with the help of therapy or nutrition or the things we're going to talk about, you definitely want to start it as early as possible. So how can parents advocate is by writing down your concerns, because you may go see your pediatrician and you may say, oh, my child isn't talking well yet, right? And that could be a concern. It doesn't mean if your child isn't talking, they have autism automatically. But a lot of kids who have been diagnosed with autism and also have speech delay. So when you see things that are different, especially if it's not your first child, right? Or even if it's your first child and things that are concerning to you, it's important that you write them down and go see your doctor and tell them about your concerns. At 18 months, every child should be getting an autism screen when they go for their well visits. So if your pediatrician or your doctor isn't doing that, that's something to ask for if there's a concern that your child may have autism.
So now we talked about autism being multifactorial, right? So, and we talked about how it's diagnosed and how to advocate for yourself as a parent to get your child either screened or early intervention is key. Would you agree, Dr. Eko?
Absolutely, yes.
So, so then now we're talking about, the family does receive a diagnosis of autism. We understand that nutrition, sleep, and gut health, this is what we're here tonight to talk about. I just want to ask a few questions received from the audience even earlier on. I want to know, how important is nutrition in managing symptoms in autism spectrum disorder?
So it's absolutely important, and I'll explain why. So with nutrition, what does that really mean, right? It's what is the child eating? What is the child, how is the child's digestive system working? All of those things play a part, right? Because in our children with autism, a lot of children are picky eaters. A lot of children struggle with sleep. A lot of children struggle with constipation, or sometimes they have loose stools. A lot of children struggle with behaviors like aggressive behaviors or just not able to focus. And so those are the common things that we see as across the board in a lot of children with autism, not everyone, but a lot of children, right? And so there's so much research that has been done that shows that our children with autism, their digestive systems don't work as well. And so they're also really deficient in important elements like magnesium and zinc and vitamin D, things that the body needs to run itself well. And so if you start off with a child who's already deficient in these things and we don't do anything about it, it doesn't get better. Unfortunately, it gets worse. So that's where nutrition comes in, because if it's not enough to just give your children the supplements, right? Say, oh, I'm just going to go buy magnesium and hand it to my kid, and that's going to solve the problem. The bigger issue is, how can we address what's going on in your child's digestive tract or your gut, your child's gut, so that when they eat food that has magnesium in it, it actually gets absorbed, and so it helps the child. And so to go even further with that question, I'm going to say, why is the gut so important, right? Because there's research again that shows that the gut and the brain are connected. Actually, the gut is often called the second brain. And so if you think about it, I'll give an example. For example, melatonin, right? That's something that a lot of us hear about, oh, give this to your kid for sleep. So it's actually created in the brain, right? But did you know that a lot of melatonin is also created in the gut? So if you think about it, if your child's gut isn't working well, already their supply of melatonin has dropped. And then I just told you that the gut is connected to the brain. So if things are not working well in the gut, then things don't work as well in the brain either. So now we're having to supplement a child with melatonin instead of us figuring out, okay, how can we heal and help this gut feel better, do better, so its production of melatonin can come back, right? So that then we don't need the supplementation, because for how long are you going to supplement someone for, really? And it's not even recommended to do it for long term. So those are the reasons why nutrition, the gut are really important and of course, the connection to the brain is really important when you're dealing with children with autism and ADHD.
And the questions have begun. So because we're still at the beginning, we're defining autism and the multifactorial nature of the disorder itself.
Right.
Are there any genetic predeterminant for autism? I think you touched on that answer already, but I see a question in the chat and I just did not want to miss it.
Yes, there are some genes that have been found that predispose that can predispose. I mean, if we discover, I mean, if the child is noted to have that gene, it predisposes them to autism. Yes, and lots more research is ongoing. So now there are genetic tests that can be done on the child, not just to see if they have the gene for autism, but more importantly, to see are they missing genes like the gene that will help folate be used in the body properly, because that's a big issue in children with autism, that they don't, and because folate is so critical for brain function, right? And the the children with autism, they don't use their folate well. So their folate is swimming around in the brain, but it's not being used because it can't connect to the receptors like it should. And so there's genes that, I mean, there's tests that can test to see, okay, does your child have this issue? Then we have to figure out another way to give them the folate and the B vitamins that they need so that their brain works well. So yes, there is definitely a place for gene testing and all of that. Yeah.
And when Dr. Hokehe says folate, folate is a B vitamins, right? So for those who may not be familiar with it, when you're pregnant, we make sure that you're taking enough folate for the brain development of the baby. But it helps you make, DNA, red cells, metabolism of the amino acids. So I just want to make sure we understand folate and what she means by that.
Thank you, Doc.
Oh, I see someone is already asking, what about ADHD? Is it also genetic?
Yes. So yes, ADHD is highly genetic as well.
All right. So
Plus,
just so
it's
I can
also
go ahead.
multifactorial. Sorry to interrupt. It's also
Yes.
multifactorial because there's prematurity can be a risk factor. There's a whole lot of things that can be a risk factor. Prematurity, age of the mother, we can get into it. Yes, there's
Yeah. And
lots
the
of
strong
factors.
family history, right?
Right.
So if you track down and you see how many people in the family had the diagnosis of ADHD,
Right.
we take that into consideration as well when we address that.
Yes.
And so, are there any, if we go back to the diet, are there any specific patterns on nutrition that seem to be in the autistic population? Is there a specific eating habit that you have noticed in your career? And specifically, what I'm asking for is, you see a lot of parents who will say, "Hey, my child is a picky eater. They only have 5 food they can eat. That's it." So, are there any specific patterns that you have noticed in the individuals within the spectrum?
Yes, so that's a big complaint that a lot of children, I would say 95% of my patients, there's only very few of my patients that don't have a picky eating issue. So most children with autism are picky eaters, and there's several factors why, right? So then I mentioned at the beginning that their digestive system doesn't work well. So if your digestive system doesn't work well, that's connected to your taste, right? And so then you're going to be really picky and not want to eat as much. And then also lots of children with autism are constipated, again, because their digestive system doesn't work as well. And if you think about it, the poop that where our bodies are made to release poop, right? Because poop is full of all the toxins that the body has gotten together, and now it's being released as waste. So if you think about this, your child's, all the toxins are sitting in there and they're not being released, right? And that's why constipation is such a big issue, because the toxins are sitting there, but unfortunately they're not just sitting there, right? What it starts to do, it starts to make small tears in the lining of the gut, and the gut is very fragile. So all that junk that's packed up back there, it starts to make openings, and then all the stuff that should be cleared out starts to get into the bloodstream and travels to the brain. And that's what essentially, that's a layman's description of what you've heard the term leaky gut. That's what that means, that your gut is leaking and all the toxins that should be released are now getting into your bloodstream and traveling to the brain. That's another way the gut is connected to the brain, because 100%, when I see children who are aggressive, they are always constipated, hands down, because they're so backed up of all the toxins and so uncomfortable, and they can't even describe, they can't tell you why or what's going on, but they show it in their behavior. So,
And that was my next question, right? So they're constipated. Well, it started with the picky eating, right?
mhm.
And then they're constipated because I'm
They're
I'll
not
let it's
getting the nutrients
the
that they
nutrient.
need,
Correct.
and they're not drinking enough water. Their taste buds are really restricted because it's all connected, right? So they are drinking sugary drinks or not enough water or more milk because milk
And not enough
constipates.
veggies.
Exactly. And then milk constipates them too, right? So then it's like all this is a really bad cycle. It just keeps going on and on. And the way to break it is you have to relieve that constipation. And I'm not talking just about Miralax. We have to clean them out and start healing the gut. So all those holes I talked about, we start fixing that. And then I have seen children go from picky eating to eating better because now their tummies have been released and we've changed what they're eating and we're healing the gut at the same time. Everything flows. I've seen children who are nonverbal become verbal once their tummies feel better. It's like, it's amazing how God made our bodies
Indeed.
function together. Yeah.
Because you answered that question a bit, because my next question was going to be someone who's that constipated, right? How will their behavior not be affected?
Of
And so
course.
then we have modern medicine. Oh, he's aggressive. Let's give him this medication. He has this side effect. Let's give him this medication.
Right.
So we keep piling one medication on top of the other instead
Right.
of actually treating sometimes, I'm not saying all the time, but sometimes instead of treating the root cause, which is constipation.
Right.
So you do see aggression a lot in children or in any patient with autism who suffer from constipation.
Yes.
So then how do you help? What do you tell to a parent listening today? But I'll get back to that in a second. We did talk about, which key nutrient are usually deficient in children with, I'm saying children a lot because that's where the diagnosis begins, right? So that's where the patterns are established.
Right.
So we see that a lot with children, but is there any specific dietary pattern or nutrition that seem to be beneficial for for families and children?
Yes. So the thing with autism is the one child with autism is the one child with autism, right? You can't,
One size fit all
there's no
doesn't
one size
apply.
fits all. So what I'm gonna say is general because there are some people who will swear that this doesn't work for them, and it's possibly true that it doesn't work for them, right? So what I would say is, in my experience, and it's backed by research, right, that gluten and dairy and sugar, those three things, right, our bodies don't digest them well. And so what's left after the digestion has happened, and remember, we have poor digestion already to start with in our children with autism, right? So after that has happened, what's left of acts in the brain like an opiate, like a drug. So it actually inflames the brain. So first of all, inflammation starts in the gut, right? And then travels to the brain. And once the brain is inflamed, the behavior, of course, is not going to be what we would like to see, right? Because I like to describe it as our brains, the kids' brains and tummies are on fire, because really that's what inflammation means, inflame, right? To burn up. So that's what it does. So gluten, dairy, and sugar are inflammatory to our children's tummies and our children's brains. So I have found in my experience, and it's also backed by research, and start somewhere. You don't have to do all three at once, right? Say we start with gluten, we take out gluten for at least 3 months. You should start to see a difference in sleep. You should start to see a difference in behavior. You should start to see a difference um, in their picky eating as well, because you're taking out the inflammatory things. So that's the way to look at it. It's not just how can I medicate it, it's how can I remove the things that are inflaming my child's brain and tummy. So, and I'll tell you a quick example. So my very first patient that I took care of with autism and with autism, she had autism and ADHD. And I had just found out about gluten and dairy and what it does, right? Because of the experience with my own child. And so I told this parent, let's try this. Let's try her off of gluten and dairy. And I was like, that's all I know at this time, right? I hadn't gotten retrained as an integrative doctor. So This child was a child I had never been able to examine because she was so aggressive, and she was nonverbal, she was constipated, she was not sleeping, the whole 9 yards, and she was on the verge of being kicked out of school because she was so aggressive. So they listened and they did it, right? They tried it. By month 4, she was sleeping better, she was pooping better, aggression had come down, right? But we were still, so we continued. By month 6, she let me touch her for the first time. I was like, what? That's when I was like,
Wow.
this stuff actually works. And then she said her first word, mama. And I was like, okay. And she was sleeping through the night, and now her parents could actually leave the house with her. So that
So
was
how
my
old was she, Doc?
experience. She was 9.
9 years old. And now we're talking about gluten and milk. So I have a question in the chat, which I'll go back to the others. What can be replaced by dairy products, right? So is milk, sometimes I always wonder, is milk a comfort food more than anything, right? We can drink it, right? It's easy. It goes down fast. They have something in the food, in the belly. But then often we do whole milk.
Yeah.
And typically when you do cow's milk, if you do cow's milk, age 2 is where we kind of,
Yeah, we're done,
it's
right?
good for brain development, and it's full of
Yeah.
fat, which causes constipation because it's not only an animal product, but it's full of fat. So by age 2 or so, once it's for brain development, we kind of stop with the whole milk. So
Right.
then I have someone who's asking, what do you replace dairy products with?
So like you just said, by age 2, the kid doesn't really need to be drinking milk, right? So, I mean, water. The brain needs the most water of all the organs in the body. And we don't like to drink water, but I'm telling everybody listening, I want you to start thinking about your brain from this angle. Whatever you put in your mouth, is my brain gonna like it or love it? Because really, if you take care of this organ, the brain, things work better. So the brain needs the most water. Get your kids to drink water. That's what they need, really, more than anything else. And instead of fruit juices, have them eat the fruits. Yes, some kids may not, I agree, but everything in moderation. If you can water down the juice, that's even better, because you have to think about the sugar, right, in the juice, like we just described, how sugar inflames the brain as well. So,
Sugar, gluten,
and dairy.
dairy.
And I'm sure there's a whole host of
There's
other.
a whole list.
Yes,
We're just giving
we're
the
just
main three,
starting there.
top 3.
So, yes. And so for a parent that is saying, okay, my kid still likes to drink something, there's lots of milks now in the market, right? Like almond milk or
Soy.
cashew milk or coconut milk. Again, you have to read the labels, because there are brands of milk that have 15 things in them. And trust me, you don't want any of those things in your kids' bodies or yours. You want to look for something that has almonds and water, and that's it. There's 2 things. There's a couple of brands I can say, like Elmhurst or Malk, just have the 2 things in it, or 3 with like sea salt or something. But yes, those are things you can swap out for.
And
But
so
go
to,
ahead.
to answer Mama Bibisha's question here, you can do lactose free, sure, and we named a few, right? But it's an acquired taste, that's for sure. I think anyone who has switched to almond milk will also tell you that it was an acquired taste.
Right.
But look at the ingredients. The key is always look at the ingredient. Just because it says milk on it, it says vegan on it, does not mean does not mean it does not have the extra sugars. So then, because we're talking about nutrition, there was a question about, would you advocate for probiotics,
Yes.
pre and probiotics?
Yes. And now, so what are probiotics? Probiotics simply is good bacteria, right? So again, our children's digestive tracts don't work well when they have autism. So that means that, and then when they're constipated, that clears out all the good bacteria, like it's done, right? So the key here is a couple of things. You need to do 2 things at the same time. So while, yes, you may be supplementing with probiotics, the thing with the supplemented probiotics, like the capsules or the powder form, is that it doesn't last as long in the system like it should, like if you were taking it from food. So you're doing a couple of things. Yes, you can add in probiotics, but then you also need to give your child foods that are rich in probiotics. For example, um, kefir, or what is this? Kimchi.
Kimchi.
Sauerkraut, also like the liquid, the sauerkraut because it's fermented, that's all probiotics. So prebiotics would be something like the fruits, like banana or something like that, before they become the organisms, the bacteria,
Yeah.
right? So those are examples, but yes, it's always important to add it in the food. Again, you cannot stay on supplements forever. That's why I don't do the whole, yes, just go take 5 supplements. You wanna work on what the child's actually eating, because that's where the long-lasting change happens. And so, yes.
And to finish up with the GI and gut, are there any red flags that parents should look for to indicate gut issues in children who are nonverbal?
Yes. So we already talked about constipation. Loose stools is another one. If your child at age 5 is having loose stools, they shouldn't be having loose stools. Any child, I mean, loose stools is like baby likes to poop. That shouldn't be happening after age 1, right? And so if you see your child continuously having that, that's an indication that something is off with their gut. If their tummies are bloated or they're always passing gas and looks really big, that bigger than it should be, that's another indication that the GI tract doesn't feel good. If you watch your child and you see when they are constipated and you see their behavior changing, or if you see your child rubbing against furniture, that's a sign that their tummies hurt and they can't explain it to you. So like they may rub it against the bed or something hard just to soothe them. That's a way to know that something's going on with your child's gut. Yeah.
And that's okay. Just because they have loose stools does not mean they're not constipated.
Correct.
To,
So
to clear that up a
let
little
me
bit. Loose
describe
stool
what
does not mean
constipation
diarrhea.
is. Yes. Constipation is a big log sitting there and you can be sloughing, so it can show up as a big chunk of poop and you're like, how did that come out of my kid? That's constipation. If you see long and skinny poop, that means it's sloughing off the side of a big log. That's still constipation. If you see tiny balls, that's constipation. If you see loose stools and then hard stools, that's constipation. So
It's leaking through.
your kid can actually go to the bathroom twice a day and still be constipated. So it's not the number of times, it's what the poop looks like. So pay attention to what the poop looks like.
So now the parent is going to ask, what should I look for in a poop? I know, guys. This is real, right? We're talking constipation. So
Right.
you need to pay attention to your child when they go to the bathroom.
And if they're sitting on the toilet for a really long time, that's another sign they're having trouble pooping. Yeah.
Okay. And so I just want to address one of the questions that was in the chat. Is there a correlation between high levels of lead in the blood is there a correlation between high levels of lead and autism?
Yeah, lead is neurotoxic, meaning it's toxic to the brain. So it's not that lead causes autism, but definitely it increases the risk of your child showing up as having autism. So
Good one. And again, remember, we said autism is multifactorial, right? We cannot pinpoint it on just vaccine or just lead or just genetics or just environmental. It's multicultural. There's one more question. What about the gummy supplement?
what gummy supplement?
Can also harm down the road. Can you clarify the question about the gummy supplement, and we'll come back to it in just a second. Sleep. As a parent, I'm a mother of 3. You are a mother of 3 as well. Sleep.
Yeah. Sleep is a big one. Yes.
Talk to me about how common are sleep disturbances in individuals or in children with autism, the diagnosis of
So
autism.
common. I think like most 95, 96% of my kids don't sleep, and their parents don't either. So sleep is a big one again, right? Autism is a brain-based disorder. Sleep is controlled by the brain. It's the brain that has a circadian rhythm that regulates our sleep. The brain produces melatonin. So if the brain is not working well, there will be less melatonin made. And if your gut is not working well, less melatonin made. And so therefore your child will not sleep well. The other things too, though, if your child has low blood iron, which lots of kids with autism have low blood iron, that too can contribute to something called restless legs, right? Where they're very restless, they don't sleep well. The other thing you want to look out for is, does your child snore? Does your child grind their teeth? Because snoring indicates that the child isn't getting enough oxygen to their brain. And again, we're back to the brain again, right? The brain is crucial, is the center stage organ in this whole thing. So that's what when I'm seeing children, I'm evaluating for all of that. Is your child snoring or grinding their teeth? That needs to get evaluated. Is your child restless? And we need to look at your child's low blood iron. Does your child have low vitamin D? Remember, vitamin D is needed, is crucial for function of the brain. So all of those things are important. Some other things that are important with sleep are, of course, think about it. If we as adults, when we don't sleep, we can't function well. So our kids that we're expecting to be these models of behavior are not sleeping through the night. In fact, they're sleeping like a few hours of the night. So aside from all the other reasons why their behavior would be off, that's a big reason, right? And so that's a really important thing to fix. And so how can we address sleep? So often we will start with routines, right? And our children with autism thrive on routines. So we want to get them into a good routine. If it's a bath or, oh, let me give you a fun tip. You can, if your kid loves water, bath them in Epsom salt. Epsom salt has magnesium. Magnesium definitely helps with sleep. And so that's another way of getting magnesium in their skin when they're taking their baths. Okay. So if we set up the routines and we want to get TVs out of our rooms, even if your child doesn't have autism, this is a public announcement. Please take the TV out of your child's bedroom, because you want to train your children to be able to sleep and understand that the room is for sleeping, not for watching TV. And so much research is showing that our TVs that are Wi-Fi driven are actually emitting rays that decrease melatonin production in the brain. So think about that. So we're giving your child melatonin, and then the TV is
It's decreasing
emitting things
melatonin,
that
and we want
decreases
them
the
to sleep.
melatonin in your brain, and then your child is not sleeping, and then we're giving the child melatonin. So yeah, just take the TV out. Yes, that will help. And
But
then,
that's okay. You said something. I'm sorry to interject there. You said something important, Reno. Imagine, when you don't sleep as an adult. But, even just speaking to all the parents out there, imagine when you have a newborn. Like it's not very hard to remember the
right,
lack of sleep and how
right,
you would almost sleepwalk, right? And so now imagine you have a young child who may or may not be verbal, doesn't sleep well, brain doesn't function well. How do you expect the behaviors to be?
right.
So we talked about, you mentioned Epsom salt bath, to put the magnesium back on the skin. I love the lavender scented Epsom salt, but don't tell anybody. But then what else? So what other routine can we put? Because usually the children will have a repetitive behavior, and sometimes that's a screen. And as parent, to calm them down, sometimes we hand them a phone or we hand them the screen. So as part of the routine, how does the screen affect us all later on and affect our sleep? You talked
Yeah,
about the TV.
right. And so the screen, because the lights from the screens tells the brain to stay awake, right? And
Right.
so if the child is staring at a screen with blue light, it's telling it stay awake, and so it's not gonna have, I mean, the sleep will be even worse and off. So if your child absolutely has to have the screen, you can build it into the routine that they have the screen before you go take a bath, and then it's bed, right? So it's a slow change. And I mean, I know that our children are used to routine. So you just slowly but surely change it out. it starts with taking the TV out of the room, right? So there's nothing to watch. But things like white noise, rain sounds, there's noise machines that you can get that will deliver the sounds that your child may need to sleep with or are used to sleeping with, let me say it that way, without the Wi-Fi interference with their sleep.
I know we're getting to the top of the hour here, or are there any other questions? Feel free to either unmute yourself or write it in the chat. We'll just take a pause for a moment. We talked about gut health. We talked about sleep, of course, nutrition. So the take-home message, nutrition truly affects our whole entire body. So if we can have better nutrition, we can have less constipation, and we can have less disruptive behavior to some extent, right? We're not saying that nutrition fixes everything, and I don't think that's what you're saying, Dr. Hokehe. There are times where medication is needed.
Right.
But the question is, have we done all that we could do on the nutrition side?
Right.
To give our children a better chance. And so then what do you say to parent? It's a hard journey. Like you say, the first patient was 9. It's been 9 years. It's a hard journey. What do you tell the parents? Right? Building routine is hard. Sometimes the child may not listen. Maybe sometimes the child may not process appropriately. What is your message to the parent?
So I always remind the parents, first of all, I like to start with, you are the best parent for your child, because our parents are often overlooked, right? Because everybody's forward facing, I mean, it's only talking about the child. Our parents need to also remember that they're doing an amazing job and that they're the best parents for the children, and we need to recognize them, right? And then I also remind parents that it's a chronic thing we're dealing with, right? And there is no magic bullet. But small, consistent changes over time makes a difference. I told you the story about the 9-year-old. It took 6 months for her to let me touch her, but it happened, right? So it's the consistency of the actions that you take. And on the days when you feel like pulling your hair out, because all of us have been there, you just remember that it may seem like your child regressed, but that's where if you have someone who can guide you through the process, then we can troubleshoot and we can get back on it, on the path. But for sure, yes, it takes time. There'll be tears. It will be hard. But if you stay the course, slowly but surely, you'll see improvement in your child. I see it every day. So I know it's possible.
And someone asked, detox heavy metals help the gut function?
Yes.
Yes.
So constipation, so the gut is one of the major organs for detox for the body. The liver is the big one, right? And then, so the liver detoxes our bodies and then sends things out through our urine, through our poop, through the skin with sweating. So if that big gut organ, that's the gateway that's supposed to release the toxins, is not working like it should, and now toxins are backed up. So yes, so getting rid of constipation is part of detoxing. And heavy metals, yes. So our environment has changed. And so there's metals in everything, from our food to personal products, you name it, the air, the water, there's heavy metals everywhere.
Yeah.
So how do you detox? How are you more cognizant of that? So for example, it's things like filtering your water, right? Washing your fruits and vegetables extra, if depending on the fruits, getting organic versus non. And it's not everything that has to be organic. So things like the berries that have a very thin skin, you want to get organic. Things like a banana that have a thick skin, you don't need to have organic. So it's not everything. And parents often say, oh my gosh, the cost. But think about it. If you're picking up chips and you're picking up the sodas, it actually costs more than the fruits and the veggies. So it's a matter of perception. It's a matter of changing the way we view it and not looking at it as an expense, because remember, whatever you put in your mouth, we are what we eat, literally, and food is medicine. And so it's just thinking about it that way. But yes, paying attention to what you're buying, read the labels. Aluminium, right? That's something that is toxic to us, but is in everything. All the aluminium foils, all the deodorants with aluminium in it.
That's
So
right.
simple things like that. Don't buy the ones with aluminium. Bake with ceramic dishes or ceramic potware instead. Those are ways that you can decrease the entrance of heavy metals. But it definitely plays a part. Yes, I test for heavy metals on our kids and they're high levels, especially with aluminum, it's like through the roof. So those are ways to decrease that. Yes.
So what I love, something you said not a few minutes ago, not too long ago, parent, you are the right parent for that child. You may not feel like it sometimes. It may be very difficult at times. And how do you build a village? Right? Because at times you as a parent need a break. Yes, we're talking about, the children today. We're talking about gut nutrition and sleep. But what about you as a parent, right? So what can we tell parents to do or to add to their own regiment to find some time to
Yes.
themselves?
Yes, we hear a lot about self-care, and those are buzzwords, but it's not in the big things, it's really in the small things. So it's us sitting down and asking ourselves, what is it that really, what do I really enjoy doing? I love taking walks. And so I will give my kids dinner and then I will go take a 5-minute walk. If that's what it takes, that's what it takes. But, it's the little things that fill our cups up. That's what we have to look out for. And it doesn't mean we're being bad parents because we're taking time for ourselves. You honestly cannot take care of our children, of your child, unless you take care of yourself. And so that's why in my practice, I'm not just treating the parents, I'm treating, sorry, not just
The
the kids,
children.
the parents. So when I tell the parents what to do for their kids, I say double the dose and do it because I'm sure you're not sleeping too. And often I get moms crying in my office because I say, well, when was the last time you slept? And then they start crying. So it's really important to ask for help. There is no shame, depending on the culture, right? Sometimes there's a lot of shame attached to the diagnosis of autism, but your child is still your child, right? The diagnosis doesn't define who your child is. Elon Musk has autism. Lots of people we know have autism. And it doesn't, when your child has the diagnosis, that's why we talked about early intervention. We start therapies, we start addressing what they're eating, their environment early. It changes the trajectory of their life. So our goal really is how can we help our children be the best version of themselves? And for them to be that, we, the parents, have to take time for ourselves. We need to work on our own sleep. We need to work on our own exercise. We need to work on our own drinking of water. All of those things are important. And if you do it as a family, right? Whatever you're doing for your child, do it as a family. So everybody is in on it. Everybody gets better together. So
You struck a nerve there, culturally.
yes.
Culturally, right? I'm from Congo, right?
I'm Nigerian.
And so what I see is that within certain cultures, I'll use an African culture, for example, it's usually your child doesn't sit down. Your child is all over the place. Your child is this, your child is that.
Right.
But nobody really understands what that parent has to deal with
Right.
at home. And we can't change that. We can't change people's reactions. We can't change the perceptions.
Right.
But when you incorporate some self-care into your routine, it's not necessarily that, sticking stones don't hurt me, words don't hurt. No, 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 no. It will still touch you, will still hurt, but incorporating some self-care into your routine allows you to just learn to brush off some of the, can I just say, inappropriate and that comment. Some of the comments are not called for, right? And parents will vouch for it. They will speak up and say that, I went to church and someone was speaking about my child. And do you think that parents will come back to church?
Nope.
So learn to take care of yourself first, parent. I usually tell my patients, when you get on that plane, what did the pilot tells you? What did they say on that intercom? Before you put the oxygen mask on your child or on anybody else, put it on yourself. It is not easy. It's a journey, but tonight we really just wanted to touch on, nutrition and, food that we eat. We are what we eat, as Dr. Hokehe said. Food is medicine. So if we can pay attention to what we are eating, and sometimes even what we eat culturally is not the most appropriate food that we should be eating and feeding our children, right? Especially when you want them to eat as clean as possible, to minimize constipation, to minimize, leaky guts, to minimize decreased melatonin, to minimize disrupted sleep. And so we do really have to pay attention to the nutrition, not just for us, but for our children as well. But honestly, it starts with us, the parent. They eat what we give them to some extent, but some of them are very picky, and we understand that. We see it. And we can keep introducing new food. But I want just you to hear us, take care of yourself, take care of the kid, keep an eye on your nutrition, and then sleep, sleep, sleep. Dr. Hokehe, any last word at all, any closing remarks you want to give our audience tonight?
Yes. So I always tell parents that it's so important for parents to become detectives of who their children are. Every child has a gift, every child has a strength, regardless of what the diagnosis is. And if we as parents take the time to recognize what that is and we boost it. So for example, I've seen patients of mine that parents will say they hear a song the first time and they can sing it in a foreign language they actually don't speak. That's a gift. If your child can see a picture and can draw it, that's a gift. So you want to boost that. If they need extra lessons, whatever it is, that's what you want to boost. And so, because then that helps you recognize that's who your child really is, right? And that increases the bond between you and your child. And then on the hard days when there are things not going the way that we would all like for them to go, then you can have comfort in that, right? And even more importantly, it boosts your child's self-esteem because they see that you see them and you recognize them. And one last thing is, it's so important to be specific when we are praising our kids. Don't say good job. Say, I like the way you did this, or that, or the specific thing, because then they're more likely to want to repeat the specific thing or the general idea of what it is that you're acknowledging them for. So that's really important because it builds their self-esteem, their behavior improves, because not every behavior in autism is because of autism. Some are learned behaviors that need to be addressed. So it's important to do that for your children and for yourself.
So Dr. K, okay, I heard everything you said. I heard all the advice you're giving me in small portions, and I want more. I want to hear more. I want to speak to you more. Where do I find you? Where do I hear more about how to take care of my child or my children or my family?
Okay. Yes. So we're on social media, Instagram at Glow Pediatrics. We have lots of content on there that show parents step by step. Here are the foods. This is where to buy it. And content like that, right? So if you have questions, our website is www.glowpediatrics.com. If you need an evaluation for your child, can contact us on there and we'll be happy to get you set up. If you'd like to join our practice and where we teach parents step by step how to address constipation, the sleep issues, the picky eating, the aggressive behavior, then you can join our practice as well. And all the information is on our website. So,
Dr. K, can I do a group at your practice?
yes, absolutely. So we do it as group visits, right? Because we want parents to learn from each other. We want parents to know that they're not alone on the journey. And so in addition to seeing our patients to give them the personalized plan, we do group sessions every week with our patients So you're getting me in there with the patient, with you, if you join our practice, where we'll troubleshoot things that are going on with you, answer all your questions. So it's lots of hand holding, because we want our parents, our whole families to do well. So yeah.
Awesome, awesome, awesome. Thank you so much, everyone, for joining us. We will not abuse of your time today. We appreciate you being here. And if you want the replay, it will be live on social media as well. I am Dr. Luyindula. I am, again, the founder and CEO of the Well MD. We are licensed North Carolina, South Carolina, Georgia, Indiana. I lost track, I think. But
We'll see Dr. Sandra. She's the best.
so if you need anything at all, if you have any questions, if you want to hear more about a topic like this, please let us know. We'll be happy to come back and discuss. If there's one specific area of autism you want to hear about, ABA therapy, how early to start, what is more, what's important, please reach out and we'll be happy to come back. If you have any other questions, feel free to unmute yourself. You still have 3 minutes. If not, we will call it a night. Don't see anybody yet, so. Oh, she would love to hear from you again.
Okay. Thank you. Oh, I have
Yeah.
a podcast if you want to hear more about it's called Brain Power with Dr. Eko. So it's on Apple, Spotify, everywhere podcasts are listened to. It's also on YouTube, same name. So yeah.
Brain Power.
Yes, with Dr. Eko.
So Brain Power with Dr. Eko on Spotify if you want to hear more
And
about
YouTube.
what we do,
Yes.
and YouTube. And you can find us all on social media as well. She is Glow Pediatrics. I am the Well MD. And it's been fun having you here tonight. Thank you for all your amazing questions and your participations. And we look forward to seeing you at the next event. Thank you for coming.
Thank you.
And thank you for coming, Dr. Eko.
Anytime.
All right. Good night, everyone.
Good night.
I almost said shalom.
Shalom. That's okay.
Good night. Thank you very much.
Oh, good night. Thank you for
Pleasure.
coming.
You're welcome.
I'm going to end the recording, Dr. Eko.